we present to you Health Agenda 2023, an interview segment on this program for presidential and governorship candidates to discuss their health agenda before the electorates. For sponsorship and participation, reach out through any of the contact details displayed on your screen.
First of all, our understanding of governance is that the greatest asset of any society are society citizens. If we don't get our people prepared to become assets, then they will keep dying as liability the way they are doing today. So in Ebonyi, for today, the numbers you gave we are kind with the numbers. We actually have 6 medical doctors in a population of about 3.5 million people. The nurses are 17 in number, pharmacists just 1, no medical lab scientists as of today. We don't have medical rehab personnel, so we don't have medical record keepers, we don't have, name them. So the first thing we tend to do differently is, first of all, to ramp up a process that expands the human capacity involvement in the health sectors. The numbers today are grossly inadequate. Our people die on a daily basis because you have people traveling 2 hours to get to where we have the tertiary healthcare facility. This tertiary healthcare facility is already overstretched because, again, they have their own issues. It's funded by the federal government. They have space challenge, they have manpower crisis, they have all kinds of issues. So we need to get our primary healthcare facilities working quickly to avert the situation we find ourselves now. Our projection is that in our first 4 years, we should be able to recruit additional 50 health workers.
50 health workers or doctors or addition?
At least 50 doctors, but we intend to expand the entire workforce of the health sector, but at least 50 doctors in the first 4 years.
Okay.
This is our projection. If we do this, the implication is that every local government will have a minimum of 3 doctors to go around the primary health care facilities. We also intend to strengthen our partnership with donor agencies. What we have in Ebonyi today is that most of the partners that intervene in the health areas are not happy with the way the health sector has been abandoned. We don't have data now for many of our primary health care facilities. Without data, you can't get support. The intervention that can be tracked because you don't know whether there is performance based on what has been invested. So we want to build and solidify those collaborations and make our performance accountable and transparent so that more people can put in resources. 2, we may not be able to get all the people we require to get, but at the rural communities, we can train people that are lower the ladder to participate in providing the basic health knowledges that are required at the rural communities. We have 171 wards across the state. These 171 wards, people who have basic training schools, WAEC, can be deployed to provide basic health support. And now we'll have a center that can provide virtual support to those facilities from remote sources. So we intend to approach this differently. We don't want to leave our people to continue to die the way they're dying. Investment in hard infrastructure, they are good, but they're not as good as investment in soft component, the human person.
Right.
If we have qualified people working in health centers, they will be able to avert much of the crisis that we faced. In the last 7 years now, almost annually, we have an outbreak of Lassa fever in Ebonyi. And these are all things that can be averted if we have the right kind of personnel, the right kind of both training, the right kind of hygiene, the right kind of information that should be available at the rural communities. So these are the basic things we think we will approach differently. Our budgetary provision also must be in line with what is globally acceptable.
Right.
We want to benchmark our budget on the SDG goals. Global awareness is part of what we should and must be able to, hinge all our programs on. We don't want to run governance that is not anchored on anything. We want to run all our budgetary processes to anchor on SDG goals, so we can measure progress and now check whether the goals we set for ourselves, whether we are meeting those goals or whether we need to do some re-evaluation of our strategy and approach. So these are some of the key things we tend to do. And I'm also happy that I have someone who is vastly experienced in this area.
Right.
In terms of assessing global fund, in terms of providing the technical skill requirement to deal with these issues. So Ebonyi is lucky that we have, the kind of human critical resources that we need to drive a governance process that will reduce the current challenge we have in the health sector. This is, in a nutshell, what we intend to do differently when we emerge next year.
Thank you very much, Prof. I'll get to the health experts on the ticket. In fact, if you were to be in the university system, you'd probably also be a professor. So you mentioned some key things that struck. One is you said secondary school leavers, could be recruited to provide some kind of support within the health space, especially at the primary healthcare level of volunteers. Which kind of roles will such people be playing?
For instance, record keeping. Nobody has any health record now. Birth record and death record. We don't have record. Nobody knows how many people are born daily in Ebonyi.
Okay.
There is no such record now. We don't know how many people die daily in Ebonyi. So we cannot make a forecast. We cannot make projections.
Right.
In terms of population projection, how do you budget for people based on population that is emerging on a daily basis? So health record is one critical component that we think we can train people with basic education to understand what to do.
Okay.
Also, health information on hygiene, basic hygiene, basic, what is it called again?
Health education.
Health education, basic health education, health promotion, sensitization, and all of that can be done by, you don't need high-tech people to provide those kind of services.
Right.
So anyone who has a background in science from secondary school, physics, chemistry, biology, mathematics, can basically fit into this lower level knowledge dissemination at the rural level. And it also creates opportunity for young people to participate in governance at that level. And now they feel sense of being part of the governance process.
Okay.
So that's the kind of thing we are envisaging to do with our young people. Even community leaders, teachers in primary schools, in the rural communities, can all get involved. The more people who can integrate into this ecosystem, the better result we can get from dealing with our health crisis at the rural level.
Right, sounds good. Finally, before we take a break, you talked about the budget, the benchmark, and using SDG as a key benchmark. So, what proportion of the health budgets do you intend to allocate to health? The Abuja Declaration of 2001 recommended 15%. Are you going to use that as a benchmark, or do you have something different?
Yes, absolutely. It's important that we take health. Like if you go, I don't know if you have read our documents for our first 4 and 8 years. Our agenda is a simple acronym, B shapes.
Right.
The B there stands for business environment. The S there stands for security. The H there is the health, which is what we're discussing now.
Yes.
Now, our cardinal focus in governance will be health of our people, education of our people, and now feeding. All of this done in an environment where people live in safety and decent environment. So the 15% is a minimum threshold, especially with the intervention fund that will come from different places. We're going to run open governance processes. People can access us and see what we're doing. So 15% for us is a modest budgetary provision for the health sector. It could be better than that as we progress, but that for us is a minimum benchmark.
Health Agenda 2023. The Nigerian health system is becoming weaker with the mass exodus of medical doctors, nurses, and other skilled health workers out of the country. In February and March 2023, Nigerians will go to the polls to elect the next president and state governors, respectively. This provides an opportunity for the election of leaders who will help to strengthen the health sector and reposition it to deliver quality healthcare services at all levels. We present to you Health Agenda 2023, an interview segment on this program for presidential and governorship candidates to discuss their health agenda before the electorates. For sponsorship and participation, reach out through any of the contact details displayed on your screen.